Hey everyone, welcome back for another deep dive. Today we were talking all about renal artery stenosis, or RAS. I know, I know it sounds a little intimidating.
Definitely a mouthful.
It is, but trust me, it's a topic worth understanding because RAS can really impact your kidney health and blood pressure.
It's true, and many people aren't aware of the link between the two.
Exactly. So we're going to unpack everything about RAS,
Yeah.
what it is, what causes it, those warning signs to watch for, how it's diagnosed, and what you can do about it.
It's a condition that often flies under the radar, so the more you know, the better.
Exactly. So let's start with the basics. What is RAS? What's going on in the body when someone has this?
Well, think of it this way. Your kidneys are like these amazing filters, constantly cleaning your blood and getting rid of waste.
Okay, I'm picturing these little bean-shaped filters hard at work.
Exactly. Now, to do their job, they need a good, steady supply of blood.
Makes sense. They need that flow to do the filtering.
Right. But with RAS, the arteries that carry blood to your kidneys, they start to narrow.
So it's like a kink at a hose.
Exactly. And because of that narrowing, less blood can get through.
Okay, so less blood flow to the kidneys. What happens then?
Well, here's where it gets tricky. Your kidneys are incredibly sensitive to changes in blood flow. So when they sense this reduced flow because of the narrowed arteries, they actually think your overall blood pressure is too low.
Oh, so it's like a false alarm going off in the kidneys.
Exactly. They're not getting the full picture. And what do they do when they think blood pressure is low?
They try to raise it, right?
You got it. They start releasing hormones that tell your body to crank up the blood pressure.
So it's this chain reaction all stemming from that reduced blood flow.
Precisely. But here's the catch. The kidneys are working overtime, pushing against that resistance in the narrowed arteries.
So it's like constantly driving with your foot on the gas. It can't be good for the engine, or in this case, the kidneys.
Exactly. Over time, all that strain can damage the kidneys and make it harder for them to do their job.
So we've got this cycle of narrowed arteries, reduced blood flow, and the kidneys trying to compensate by raising blood pressure, which then puts more strain on them. It makes sense now why it can be so dangerous. But I'm curious, what causes these arteries to narrow in the first place?
Well, there are two main culprits. The most common is atherosclerosis.
Oh, I've heard that term before. Isn't that the buildup of plaque in the arteries?
You got it. It's basically like gunk accumulating in the pipes, making them narrower.
And this is the same process that can lead to heart attacks and strokes, right?
Exactly. It affects arteries throughout the body, and the renal arteries, the ones supplying the kidneys, are no exception.
So anything that increases your risk of heart disease would also increase your risk of RAS.
Exactly. Things like smoking, high cholesterol, diabetes, those all play a role.
Okay, so healthy lifestyle choices are crucial for prevention.
Absolutely. Now, the second cause of RAS is a bit less common, but it's called fibromuscular dysplasia.
Fibro what? That's a mouthful.
It is. It's a condition where the walls of the arteries develop abnormal tissue growth, causing them to narrow or bulge in certain spots.
Ah, I see. So even though the causes are different, the end result is the same. Those arteries leading to the kidneys get narrowed.
Exactly. And that sets off that chain reaction we were talking about before.
So we've got atherosclerosis, the gunk in the pipes analogy, and then this fibromuscular dysplasia, which is more about the structure of the artery walls themselves.
Exactly. Now, one of the trickiest things about RAS is that it often doesn't have any obvious symptoms, at least not in the early stages.
So it can be lurking beneath the surface, causing damage without you even knowing it.
Exactly. It's kind of like a silent threat.
That's worrisome. So how do you even know if you have it? What should we be looking out for?
Well, there are some clues.
Okay, good. So it's not completely invisible.
Right. One of the most common signs is having trouble controlling your blood pressure, even with medication.
Ah, so if your blood pressure is stubbornly high, it could be a red flag.
Exactly. It might be a sign that something else is going on, like RAS.
So even if you're already being treated for high blood pressure, it's still worth considering RAS as a possibility.
Absolutely. And another thing to watch for is any sign of declining kidney function.
Okay, but how would you even know that your kidneys aren't working as well as they should be?
Well, that's where those routine blood tests come in.
Ah, those checkups are important for a reason.
Exactly. Simple blood tests can reveal a lot about your kidney health.
So we've got high blood pressure that's hard to control
Hmm.
and possible signs of kidney problems showing up in blood work. Are there any other symptoms that might point to RAS?
Yes, some people experience swelling in their legs or other parts of the body.
Swelling. How is that connected to the kidneys?
Well, when the kidneys aren't functioning properly, they can't remove excess fluid as efficiently, and that fluid buildup can cause swelling.
Ah, I see. So it's all connected.
It is. And in some rare cases, someone with no history of high blood pressure might suddenly develop it. That's a situation that definitely warrants further investigation.
So we've got those high blood pressure issues, kidney function changes, potential swelling, and those sudden spikes in blood pressure, all things to be aware of. But how do doctors actually diagnose RAS? It sounds like it could be a bit of a puzzle.
It can be. There's no single test that definitively says you have RAS. It's more about piecing together the clues.
So it's like detective work.
Exactly. Doctors use a combination of methods to figure out what's going on.
Okay, so let's walk through that process. Where do they usually start?
Well, it often starts with a thorough medical history and physical exam.
Makes sense. Get the basics first.
Right. Then they'll typically order some blood tests to check kidney function.
So those blood tests can reveal if something's off with the kidneys.
Exactly. And if those tests raise any red flags, the next step might involve imaging tests to actually see the renal arteries.
Oh, so they can actually visualize the arteries and see if there are any narrow spots.
Precisely. There are several imaging techniques that can be helpful.
Okay, so let's talk about those imaging tests. What kind of tools are we talking about here? What can they actually see?
One common test is a Doppler ultrasound. It uses sound waves to create images of the blood flow through the arteries.
Oh, so it can show how the blood is moving through those arteries. That's pretty cool.
It is. And it's non-invasive, so no needles or dyes or anything like that.
That's good to know. Are there other imaging options if the ultrasound isn't clear enough?
Yes. If needed, doctors might recommend CT angiography or MR angiography.
Okay, those sound familiar. Aren't those used for other parts of the body too?
Yes, they're used to visualize blood vessels all over the body.
So how do they work? I always forget.
Well, they use special X-ray techniques or magnetic fields, depending on the type of scan, to create really detailed pictures of the arteries.
So they can see really clearly if there's any narrowing or blockage in the renal arteries.
Exactly. They give a very precise view of what's going on.
Wow, it's amazing what technology can do these days.
It really is. And in some cases, a more specialized test called renal arteriography might be used.
Okay, what makes that one different?
With this test, they actually inject a contrast dye directly into the renal arteries and then take X-rays.
Oh, so they're highlighting the arteries to make them show up more clearly on the X-ray.
Exactly. It provides the most detailed view of the arteries and helps confirm the diagnosis and guide treatment decisions.
Okay, so let's say someone is diagnosed with RAS. What happens next? What are the treatment options?
Well, the good news is that there are effective treatments available, and the goal is really twofold.
Okay, what are the two main things doctors are trying to do?
First, they want to restore good blood flow to the kidneys.
Makes sense. Get those kidneys working properly again.
Right. And second, they want to protect the kidneys from any further damage.
So it's about fixing the problem and preventing it from getting worse.
Exactly. And the specific treatment approach will depend on several factors, including the severity of the RAS and the overall health of the individual.
So there's no one-size-fits-all approach?
Not really. Treatment plans are very individualized, but often the first step is making lifestyle changes, especially if atherosclerosis is contributing to the RAS.
Right, so going back to those healthy habits we talked about earlier.
Exactly. Things like quitting smoking, eating a heart-healthy diet, managing diabetes if you have it, and getting regular exercise.
So those lifestyle changes can not only help prevent RAS, but they can also be part of the treatment plan.
Absolutely. They're essential for managing the underlying conditions that often contribute to RAS.
Okay, so lifestyle changes are a big part of the picture. What about medications? What role do they play?
Medications are often prescribed to help control blood pressure and protect the kidneys from further damage.
Ah, so keeping that blood pressure in check.
Exactly. There are several types of blood pressure medications that might be used, and the specific choice will depend on your individual needs and medical history.
So it's not a one-size-fits-all approach there either.
Not at all. It's all about finding what works best for you.
Okay, so we've got lifestyle changes and medications. What if those aren't enough? Are there other options?
Yes, in some cases, a procedure might be recommended to physically open up the narrowed renal artery.
Oh, so they can actually go in and fix the narrowing.
Exactly. One common procedure is called angioplasty with stenting.
I think I've heard of angioplasty for heart blockages. Is it the same idea here?
Yes, it's very similar. A thin, flexible tube with a tiny balloon on its tip is inserted into an artery, usually in the groin or arm.
Okay, so they're threading this tube up to the blocked artery.
Exactly. And once they reach the narrowed section of the renal artery, they inflate the balloon.
Oh, I see. So that pushes the blockage out of the way.
Exactly. It helps widen the artery and restore blood flow. And to keep the artery open, they often insert a small, expandable metal mesh tube called a stent.
So the stent acts like scaffolding, holding the artery open.
Precisely. It helps prevent the artery from narrowing again.
That's clever. So angioplasty with stenting, that's one option for actually opening up that narrowed artery.
It is, and it's generally very effective in improving blood flow and controlling blood pressure.
That's good to hear. Are there any downsides to this procedure?
Well, like any medical procedure, there are some potential risks.
Okay, so what are some of the things people should be aware of?
The most common risks are bleeding at the catheter insertion site and a small chance of infection.
So those sound like the usual risks you might expect with any kind of invasive procedure.
Right. And there's also a small chance that the artery could re-narrow over time, but even if that happens, angioplasty can often be repeated.
So it's not always a permanent fix.
Not always, but it's often a very effective way to manage RAS.
Okay, so that's angioplasty with stenting. You mentioned earlier that surgery is sometimes an option too. When would that be necessary?
Surgery is typically reserved for more severe cases.
Okay, so like when the blockage is really bad or angioplasty hasn't worked.
Exactly. Or if the artery is too damaged for angioplasty. In those situations, a surgical procedure called renal artery bypass might be recommended.
Renal artery bypass? What's that? I haven't heard of that one before.
It's a bit more involved than angioplasty, but it can be very effective. Basically, they create a detour around the blocked portion of the renal artery.
Oh, so they're bypassing the blockage completely.
Exactly. They use a graft, often a piece of vein taken from another part of your body, to create a new pathway for blood to reach the kidney.
Wow, that's some pretty impressive surgery.
It is. But it's important to remember that surgery is usually a last resort.
Right. So it's good to know all the options. From lifestyle changes to medications to procedures and surgery, it sounds like doctors have a lot of tools to help manage RAS.
They do. And one thing I always emphasize is the importance of follow-up care after any treatment for RAS.
So it's not just about the initial treatment.
Not at all. Ongoing monitoring is crucial. Regular checkups with your doctor are essential to keep an eye on your blood pressure, your kidney function, and your overall health.
So it's really a team effort between the doctor and the patient.
Absolutely. Working together is key to successfully managing RAS.
Okay, so regular checkups, continuing those healthy lifestyle habits, and taking medications as prescribed. It sounds like it's all about maintaining those healthy habits even after treatment.
It is. And remember, if you ever experience any new or worsening symptoms after treatment, like uncontrolled blood pressure, decreased urine output, or swelling, be sure to contact your doctor right away.
Don't ignore those warning signs.
Exactly. Early intervention is always best.
Now, before we wrap up, we talked earlier about how sneaky RAS can be. It often doesn't show symptoms until it's already progressed. So what can our listeners do to be proactive about their kidney health, even if they're feeling perfectly fine right now? What advice would you give?
Well, I think the key takeaway is that you don't have to wait until you have symptoms to start taking care of your kidneys. Prevention is always the best medicine, right?
Absolutely. So what can we do to be proactive?
First and foremost, don't skip those annual checkups, even if you feel perfectly healthy.
Those checkups can really catch things early.
They can. And during those checkups, your doctor will check your blood pressure, and depending on your risk factors, they might suggest some simple blood and urine tests.
To check on those kidneys.
Exactly. Those tests can pick up on early signs of kidney disease, including RAS, before you even have symptoms.
Wow, so those routine tests can really be lifesavers.
They really can. And beyond those checkups, it's about making healthy choices every day, maintaining a healthy weight, eating a balanced diet, getting regular exercise. Those are all good for your kidneys as well as your heart.
It's all connected.
It really is. And of course, if you have any risk factors for RAS, like a family history of kidney disease, diabetes, high blood pressure, or high cholesterol, it's extra important to be vigilant about your kidney health. Talk to your doctor about any concerns you have.
Don't be afraid to ask questions.
Exactly. Knowledge is power when it comes to your health.
Well, this has been such an eye-opening conversation. I feel like I've learned so much about RAS, a condition I honestly knew very little about before.
It's a condition that often goes unnoticed, so I'm glad we could shed some light on it.
Me too.
Eh,
Any final words of wisdom you want to leave our listeners with?
Just this. Take care of your kidneys. They work hard for you every day, so show them some love. Eat well, stay active, manage those risk factors, and get those regular checkups. Your kidneys will thank you.
Great advice. Thanks for joining us on this deep dive into the world of RAS. We hope everyone learned something valuable today. Remember, early detection and proactive management can make a world of difference. Until next time, stay curious and stay healthy.